Hi everyone, my name is Dr. Victor Pylro and I'm a professor at the Department of Biology from Federal University of Lavras. And today I'll be presenting our work entitled the Telemedicine and Molecular SARS-CoV-2 Early Detection to Face COVID-19 Pandemic. So as a brief introduction, we may know that the pandemic of COVID-19 brought a lot of plethora of challenges to the academic community, including the social distance measures. The interruption of face-to-face activities has obligated us to work in remote work and to provide online class. And of course, we believe that for a safe return, we need to monitor the individuals to make the quick detection of infection, make the contact tracing and isolation of those infected people. So the goal of this work is to report our experience here in teleconsultation that we provided at the Federal University of Lavras, and also the assembly of a laboratory for molecular diagnosis, which is called LabCovid, as a strategy to face the COVID-19 pandemic at the Federal University of Lavras. So briefly, our work was carried out at the Federal University of Lavras, which is also called as UFLA. All analyzed data were protected. I mean, the data was by the de-identification process. The telecovid program was composed by a team of students who gave support to patients regarding COVID-19, and of course, when necessary, they made the referral for online consultations with medical professionals. And of course, in the suspicion of SARS-CoV-2 infection, the doctors has asked for RT-qPCR testing, which was provided by the LabCovid, which is a laboratory for molecular diagnosis of SARS-CoV-2 that we have implemented here at Federal University of Lavras. So, as a result, I can say that since June 2020, the telecovid program has carried out more than 3,000 assists. And at the same time, the LabCovid performed more than 6,000 molecular tests. As we can see here in this chart, the number of calls received by the telecovid, which is here represented by this orange colored curve, fits almost exactly the number of positive results processed by LabCovid. So, based on these results, my final message is that the telecovid was effective in reducing face-to-face medical care by preventing and also helping us to prevent the collapse of the health system here in the municipality of Lavras and region. And also, this well-designed project has allowed us to assist thousands of patients and their contacts during this time. So, before finishing, I'd like to thank you for watching, to thank my university, the GreenMetric organization, and also all the agencies supporting science in Brazil. Thank you very much.